Greetings. My name is Sarah Adams. I'm the MCC representative for Lebanon and Syria. I'm based in Beirut. I used to travel frequently to Syria, but in the last few months as a foreigner, it's been more and more difficult for me to get a visa. So I haven't been able to go in person as much as I would like. Most of our communication right now with our partners is through visits here in Lebanon when they come, as well as phone calls and emails. Though phone calls and emails can also get difficult with the communication system right now. Probably the most challenging thing that we've faced in Syria is that this situation is totally new for Syria. Syria hasn't faced conflict like this in any recent times. So people that are displaced from their homes, people that don't have jobs, people that have no income, no ability to buy food or medicine, it's new for them. They're not sure how to deal with this kind of need. As one of our partners said, it's almost in some ways shameful for some people to come forward to ask for help. So the partners that we work with have had to be very careful about how they approach people. Sometimes that might mean they need to go visit people in their homes rather than asking people to come to a public place to ask for assistance. The whole system of life has changed, the whole economy has changed, and people just aren't sure yet how to deal with this new reality. MCC's main interest is in the humanitarian side of the need. We have been in Syria for more than 20 years, and during that time we've worked with churches and local organizations serving the community. We don't have a political bent in Syria, and we're not as interested in the political side of things as we are in the human side. So we're doing whatever we can to meet the needs of everyone and trying to find ways to distribute aid to anyone in need, regardless of their political affiliation. To do this, we're working with different churches as well as local NGOs. We're working through the Syrian Orthodox Church, somewhat through the Greek Orthodox Church, as well as the evangelical churches there. We're also working through local committees, and in all of these instances, we try to form community-level committees where there are a mix of people from all sides on the committee, so that they're making decisions about who is getting support, they're setting criteria for who needs support, and they're distributing it fairly. We're trying to make sure not to give it just to one group. One problem that we've seen just in the last couple of months, which is very disappointing, is that the conflict as it goes on, people that used to be neighbors, Sunnis and Christians and Shia that used to be neighbors and get along well, are now in conflict. They've started to maybe not trust their neighbors as much as they have. When violence happens or when houses get looted, they're not sure who did it, so it's easy to place blame on other people. So this is what our partners say is one of the most saddening things about the experience, that centuries of goodwill and living side by side have been broken down by this conflict. So we're trying through our support to make sure that we don't exacerbate any of that, but we use the support as a way to bring people back together and maintain trust within communities. The most difficult part for our friends and partners in Syria is the ongoing violence. They see their homes destroyed, they see their family members and their neighbors killed. The partners that we work with are calling for an immediate end to the violence from all sides. They don't feel that further violence, especially violence supported by external countries, will lead to a long-term peaceful solution. They realize that any further violence, every day people are getting killed, every day. And until we can stop the fighting, people will continue to get killed. And no matter how organized things may seem, innocent people are always killed in the violence like this. It's never just the conflicting parties that are affected, it's all people in the entire country. So they're really calling for an immediate end to the violence. Once that happens, there's a real need for reconciliation work. As I mentioned, people's relationships have really been destroyed through this process. It's sad to see neighbors who don't trust each other anymore, speak negatively about each other. So especially the churches we work with are very interested in long-term reconciliation between all the different communities to make sure that they can live together peacefully as Syrians once again. In the city of Homs and the surrounding villages, we're working directly with churches and local community committees to provide support to people. Just a few examples of the types of things we're doing. There was a man who was injured by a bullet. He was crossing the street in Homs and he got hit by a bullet. He doesn't know who the bullet came from. He doesn't know if they were targeting him, but the end effect is he's paralyzed now. So he's in need of medical care, and his family is in need of a lot of support because they no longer have any income. They've also had to move outside of homes to a safer place. Another young man that we have talked with through the church is a man who has diabetes. And as I mentioned before, he was a bit shameful to come forward and admit that he needed help. And only when the priest went and talked to him privately did he admit that he hadn't been taking his medication for the last couple of weeks because he hadn't been able to afford it. So we're also helping with cases like that where people can't afford their medicine anymore. We're also supporting a number of children. We've supported an orphanage and homes for many years, and unfortunately their building has been destroyed, their orphanage has been destroyed, and they've had to move out to different villages. They moved once, and unfortunately the fighting moved to that place, and then they had to move again. So we're trying to make sure they're being kept safe, but the church is moving them from place to place. So we're continuing to support them, trying to keep them in school in some form in the new villages that they're at, making sure that their new host families have funds to provide for their food and medical care and those sort of needs.